Now, let's try to understand DUPA, right? What is DUPA? DUPA is diffuse unpatterned alopecia. And I think there's a study that we can kind of look at that can help us understand how DUPA, it's sometimes also referred to as a sort of female pattern hair loss, how it can kind of differ from androgenetic alopecia. So this is the DUPA in the case where it's actually based in androgenetic alopecia. So for additional context, let's look at Kamishima et al.'s paper titled, quote, Divergent Progression Pathways in Male Androgenetic Alopecia and Female Pattern Hair Loss, Trichoscopic Perspectives, unquote. The 9 quantitative trichoscopic factors identified in the study included hair diameter diversity, which measures the variation in thickness of individual hairs within the same area of the scalp. This factor is significant because greater diversity in hair diameter often indicates the presence of miniaturized hairs, a hallmark of androgenetic alopecia. Next, we have hair density, and this is another key factor that represents the number of hairs per square centimeter of the scalp. So lower hair density is a common characteristic observed as hair loss progression, providing a clear indication of how much hair has been lost in a given area. Next, we have the percentage of thin hairs, and this is a critical factor because it evaluates the progression of hairs below a certain diameter threshold, highlighting an extent to which follicular miniaturization has occurred. This factor helps quantify the number of finer hairs compared to the normal, thicker hairs, which is crucial in assessing the severity of hair thinning. So in men, androgenetic alopecia typically follows the patterns of the Hamilton-Norwood scale. The early stages often involve a receding hairline, thinning at the crown, and also vertex. As the condition progresses, extensive baldness occurs in the frontal and vertex regions of the scalp. However, the occipital and parietal areas are typically known as the safe donor areas because these, for whatever reason, are less impacted by DHT. It's just a genetic feature. One of the early signs of male androgenetic alopecia, as described by this paper, is significant reduction in hair diameter. This thinning of hair strands indicates the onset of follicular miniaturization. As the condition advances, the diameter reduction becomes more pronounced. Additionally, there is a decrease in the number of hairs per follicle unit. So, as we know, each hair follicle produces maybe 2 to 3 hairs, 3 to 5 hairs sometimes. Lucky people might get even 6 hairs per hair follicle. So, if you're having a decreased number of hairs per hair follicle, this increasingly leads to single hair follicle units. And this causes a reduction in hair clusters and reflects a decline in overall hair density as fewer hairs are growing together in groups. Now, female pattern hair loss, on the other hand, and I'll just say this, I'll put this in here, it often kind of adopts a DUPA or a diffuse unpatterned alopecia kind of look, is often assessed with various scales. This study talked about the Ludwig scale, and this kind of differs from the traditional male androgenetic alopecia. So, in female pattern hair loss, it typically is the case that you have diffuse thinning all over the scalp and the crown while maintaining a frontal hairline, much like DUPA. So unlike the distinct recession patterns that you see in male pattern baldness, DUPA or female pattern hair loss involves a sort of uniform reduction in hair density across the scalp. So we can really get an idea of DUPA by looking at female pattern hair loss. So if the hair loss is kind of progressing in this sort of fashion, and if you do a biopsy, then you may be able to determine, hey, my DUPA is due to androgenetic alopecia and not any other condition, right? There are some telltale signs that the doctor, if they're good enough, the dermatologist, can see with their eye to kind of indicate that, okay, your DUPA is due to androgenetic alopecia, it's due to a sensitivity to DHT. But if you're still concerned, you can still get that biopsy done. Now I want to backtrack a bit here, right? As reported by Olsen et al. In the 2005 review paper, quote, Evaluation and Treatment of Male and Female Pattern Hair Loss, unquote, men are biopsied only when they present with a female pattern kind of hair loss. So again, this overall approach kind of overlooks cases of men who have even pattern forms of lichen planipilaris or even frontal fibrosing alopecia. So what am I seeing here, right? Well, let's look at the study performed by Martin S. Zinkernagel and Ralph M. Trueb, or Dr. Ralph M. Trueb, in 2000 titled, quote, Fibrosing Alopecia in a Pattern Distribution, Pattern Lichen Planipilaris or Androgenetic Alopecia with a Lichenoid Tissue Reaction Pattern, unquote. And this study indicates that even scarring alopecias like lichen planipilaris can present in patterns similar to androgenetic alopecia. Look at that. That's kind of worrying too. So it isn't always the case where dermatologists can just look at the scalp and say, well, it kind of looks like androgenetic alopecia, right? Because it can adopt a sort of manifestation mimicking a norwood progression when in reality that person could also have, androgenetic alopecia, but maybe they have more of that lichen planipilaris condition in that sort of Norwood mimicking fashion. So again, yes, what do we do here in this condition? Yes, biopsy. You would use a biopsy to determine whether or not you, as an individual who's getting worse on something like dutasteride, maybe you have this sort of lichen planipilaris that's mimicking androgenetic alopecia. So I'm just urging people here to just go get checked.